We're here at Cleveland Clinic with Dr. Marc, who's going to tell us about a remarkable new treatment for a specific kind of stroke that occurs in the brain. What is it that you can do that's new?
Yeah, so there's a lot of patients out there that suffer from something called intracerebral hemorrhage, which is a hemorrhage deep in the brain. And previously, this was very hard actually to access. A lot of times, this is from high blood pressure. The high blood pressure causes a hematoma deep in the brain.
So way in the brain.
Way in the brain, under the skull, yeah. And as you can imagine, there's a lot of important brain tissue that's there that we can't get to that hemorrhage.
Right.
The hemorrhage can cause multiple problems. It's a large mass in the brain, so it can push on nerve fibers. And the breakdown of the hemorrhage actually can cause damage to the brain over a couple weeks. So getting the hemorrhage out may be of benefit to patients.
Gotcha. So if somebody has a bleed deep in the brain, a type of stroke, one of the goals, in addition to making sure no more bleeding occurs, is to evacuate the blood, get it out of there.
Exactly, exactly. And we've had some difficulty doing that because there's so much important brain tissue separating us from the hemorrhage. There's been new advances, and there's been multiple studies looking at doing routine surgery where we actually make a big piece of bone off and go through the brain to take this hemorrhage out, and that has never been proven to be beneficial. Now we have new devices that are using minimal access approach where we can actually go through the wrinkles of the brain, get to the hemorrhage, and then operate to take the hemorrhage out in a safer, less collateral damage per se fashion.
I see you've got something in your hand.
I do, yeah. So this is actually the instrument that we use, and this instrument, although it looks large, actually is a pretty small. It's only about 13 millimeters right here of an opening. And what this allows us to do is we can actually go down through the wrinkles of the brain, insert the tube. This inner part comes out, and using a microscope, we can actually operate down this port, and it preserves the nerve fibers and holds the tissue out of your way so you can get the procedure done.
This is relatively new. How are the results to date?
So we have one of the larger series in the U.S. right now looking at this. And it was an initial series, about 25 patients, and a lot of our patients have done very, very well. One of our patients that we just operated on actually came in, her left arm was not moving, and her left leg was not moving. She was unable to speak, and very quickly after taking the hemorrhage out, she was able to regain a lot of that function.
That's fabulous. So this is time sensitive, though,
Very
like
time
all
sensitive,
strokes.
and we're trying to see that. Yeah, it's just like a stroke. We have some initial data that says under 8 hours actually may be very beneficial for patients. So we're trying to get this done in an urgent or emergent fashion.
This is a great new option because stroke can be so devastating, but now a new way to fix it.
Exactly. A lot of what we've done is with ischemic stroke, and this is hemorrhagic stroke, which sometimes we can't do much about. So at this point, this is another good option for patients.
Outstanding. For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.